This presentation is about the newer tests that can assure you that your pregnancy is going well and your baby is going to be healthy. I will discuss newer tools in pregnancy that are designed to show that your pregnancy is well and also will continue to go well. I am Dr. Mark Taslimi and I specialize in care of high-risk pregnancies. Right off the bat, it is important to date the pregnancy accurately. Dating of the pregnancy will be useful in the beginning of the pregnancy as well as the pregnancy continues and your doctor gives you newer tests to assure that your baby is fine, and many of them are gestational age dependent. There are many ways of knowing the date of the pregnancy or how far pregnant you are. You probably have a good idea about how far pregnant you are by last menstrual period and sometimes by knowing when you have actually conceived. But what we have learned is in about 1 in 7 or 8 pregnancies, the dating of the pregnancy is not all that accurate. Now we have tools to show you how far pregnant you are. I would recommend to establish the age of your pregnancy by around 2 months of the pregnancy. And one way of doing that is by performing an ultrasound by your doctor that will measure the baby's size and will establish the age of the pregnancy more accurately. As continue your care under your physician, I would suggest that at around 3 months to ask your doctor to do another ultrasound. In this ultrasound, the doctor can measure the little fluid space that normally is behind the baby's neck. This tiny area in the back of the baby's neck at that early stage of pregnancy is called NT. That stands for nuchal translucency. What can doctor learn from that? When a doctor sees a normal NT, normal in size and shape, the doctor can assure you that the baby is at a very high probability of having a normal heart structure, and also a very high probability that your baby's chromosomes are normal. The doctor will once again assure you that you are carrying only a singleton pregnancy, or if now a twin pregnancy is shown up that couldn't be seen last time, sometimes that does happen. At the same time, the doctor will offer you a blood test. The blood test is done from the mother, just like any other blood test that you do during pregnancy, and they draw the blood from your arm. This blood test measures the hormones that come from the placenta of the baby to your circulation. Now, what do we learn from that? What we can learn from the level of the hormones that comes from the placenta to your bloodstream, we can tell that the placenta is functioning normal. Like I tell my students, all healthy babies have healthy placentas. So you continue your care with your doctor, and now you make it 4 months. At this time, the doctor will repeat the same blood tests that you did when you were 3 months pregnant. And it will measure the same hormones of the placenta and plus 1 or 2 more. And adding the first and the second blood test will even give you a better, higher assurance that your pregnancy is going well, not only from the baby's point of view, that the baby has a high probability of having a normal heart and normal chromosomes, but can also tell you that the risk for having complications of pregnancy, such as high blood pressure, otherwise called preeclampsia, and preterm labor is low. And in other words, your blood pressure will remain normal and your pregnancy will continue towards term pregnancy. Next, the doctor will see you at around 5 months of pregnancy. At this time, the doctor will recommend that you have a full fetal ultrasound. And this ultrasound consists of several things. One is that a sonographer who specializes in doing ultrasound for fetuses will tell you that the baby's structures are normal from top to bottom. Brain, heart, kidneys, arms, legs, and many other organs. Also, you will learn that there is normal fluid around the baby, amniotic fluid around the baby. And you will also learn that the placenta is in a normal location in the uterus. And you will also learn that the cervix, the mouth of the womb, is close and long, and that it decreases the risk of going into early labor. It increases the chance that the pregnancy is indeed going to continue towards full term. To summarize again, by now you are in mid-pregnancy. By now you know that the chances are very high that your baby is healthy, and the chances are very high that your pregnancy will continue to be normal and healthy. And God forbid, if something is not right, your doctor will have a chance to send you to a maternal and fetal specialist physician like me, and they have more tools to check your pregnancy. Those tools are too many, and I don't want to go into too much of a discussion of that. But the good news is that there are even more tests available to assure you as pregnancy goes on that indeed everything is going well. Next is the step to test you for possibility of developing diabetes due to pregnancy or during pregnancy. This test is done at around 6 to 7 months of pregnancy. Women who are susceptible to develop diabetes later in life will show that during pregnancy they have diabetes. The test is done by a sweet drink that doctor gives you, checks your blood sugar in 1 hour, and if necessary, repeats the test in a 3-hour test. Your doctor will discuss the details with you further. And if in case you have diabetes in pregnancy, the doctor will send you for diabetes and diet counseling. That includes consultation regarding a change of lifestyle into a healthier lifestyle of exercise and eating habits. Your pregnancy is continuing. By now you're showing pretty good, and now you have made it to 8 months of pregnancy. At this stage, your doctor, many doctors, will recommend another ultrasound examination. This ultrasound examination will actually confirm that your baby is growing normal. The amniotic fluid around the baby is normal. They will once again check the structure of the baby. A bigger baby shows you better structures and assure you that nothing new has developed in the baby's parts and organs. Furthermore, the doctor will or may recommend to do what is called NST, which stands for non-stress test. Basically, they put you on a belt and a machine that records the baby's heart rate, and doctors specialize in interpreting that tracing to show that your baby is actually healthy and doing well. You can also test your baby's well-being yourself. And this is a very useful and reassuring test. You can count your baby's kicks in the womb. This is a test that you can do it at home. You can do it more than once a day, and you don't have to go anywhere or pay anybody to do this test, and gives you the assurance of baby being healthy and doing well. Actually, is a very valuable test to consider. This was a brief presentation on all the tests that are available to you to assure you regarding the health of your pregnancy. For more information, I would encourage you to go to extensive sources of information that's available to you. These sources are mostly available on internet and includes publications from academic centers and publications from the government, particularly from National Institute of Health, which is shown by a URL or address of nih.gov. These publications, if you want to search them, you can look for NT for nuchal translucency, PNS for prenatal screen, which is the 2 blood tests that I was telling you about, as well as NST or non-stress test, as well as GDM or gestational diabetes mellitus, as well as fetal kick count, and of course fetal anatomy ultrasound.